My name is Manny Pelagio, and this is my psychology in film assignment. We're analyzing the character Nina Sayers from the film Black Swan. Nina was a talented but highly anxious ballerina that lived in New York City. She danced in an elite ballet company where perfection, discipline, and strict control were expected every day. And when at home, she lived with a strict mother who controlled her environment, which did limit her independence. Together, overall, her home life and the intense ballet culture created a high pressure setting that strongly affected her mental health. There are also many stigmas around OCD in our culture. Many people treat it as a joke or use it as a term to describe being neat or organized. This trivializes the disorder and makes people less likely to seek help. Looking more broadly across cultures, OCD is found worldwide, in my opinion, through the specific themes of obsessions or compulsions can vary. Research by Abramowitz and colleagues 2021 showed that culture shapes how OCD symptoms appear, but the disorder itself exists around many societies. This disorder itself exists across many societies. This suggests that OCD is not limited to Western culture. Their cultural expectations may shape how it looks. A clear symptom that Nina displayed is compulsive skin picking. In multiple scenes, she scratches her back or fingers until she bleeds. And this type of behavior is consistent with compulsive behaviors meant to reduce tension. And skin picking is well documented within the OCD spectrum. A symptom Nina does not strongly show is contamination fear, which is one of the more common OCD symptoms. She doesn't really engage in washing rituals or express fear of germs, and that shows that OCD can vary widely across individuals. In terms of treatment, the best plan for Nina would be exposure and response prevention therapy, also known as ERP, which is a form of cognitive behavioral therapy. ERP works by helping individuals face feared thoughts or situations without performing compulsions. Research shows that ERP is one of the most effective treatments for OCD and significantly reduces symptoms for most patients. Looking at the film from different perspectives, Black Swan portrays anxiety, compulsions, and perfectionism realistically. However, the intense hallucinations, dramatic psychological breakdown are exaggerated to the max for a cinema effect and are not typical of OCD alone. Films often use mental illness to heighten drama, which can influence how people understand real disorders. And when movies exaggerate or sensationalize symptoms, it can create misunderstandings or reinforce stigma about mental health.